Even though hospice care is becoming more common, many people still have questions about hospice and may even be hesitant to call because they don't know what to expect. Well, that's what we'd like to talk to you about. We want to take away your hesitation about phoning hospice, whether you're considering this type of care for a family member or just have questions. Here are some common questions about hospice. What kind of help can you expect? Will you still be able to see your own doctor? How is hospice different from home health care? Once a person is in hospice, can they leave? How much does it cost? One of the best ways to answer your questions is to hear from those who have called on Grace Hospice. You will hear from husbands, a wife, a son, and a daughter. In all these cases, the doctor has told the family that further medical treatment will not improve their relative's illness. You will also hear from doctors who have relied on hospice professionals to expand the care they give their patients and families.
Our dad's local doctor recommended that we consider the hospice service, and so we chose Grace Hospice to care for Dad, and we chose to do it at our home, where that way it wouldn't upset our daily routine as much, and he could be there with us, you know. So we brought him to the house, and started out as a basic day-to-day routine. Dad's friends would come by and visit with him every day. Some of my mom's friends would come by and visit with him. He had regular visitors every day to come by, you know. We were under home health care for a short period of time, and then we realized that we needed something, Dad needed something more, and Grace Hospice came in to assist us in working with Dad. The hospice service, their service changed from day to day depending on what Dad's needs were. Everybody came in, all of his Dad's friends came in and visited with him, and so it was a real good time where we could all visit together with him and say the things that we needed to say to him. My mother died 10 years before Dad died with colon cancer. She was confined to the local hospital, and so our time there was limited, and our hours were limited where we could spend quality time with her, and certainly we couldn't have the whole family there, you know, to visit with her and all that. So it was a marked difference 10 years later when Dad died. The whole death experience was a whole different deal. We were very encouraged through the hospice process, because we were able to be with Dad whenever we wanted to be, and then whenever we didn't need to be, then they took over and took care of him. You know, we were all able to say the things that we wanted to say to him. And
it was such a blessing because they were so good. They were just wonderful. I couldn't have asked for anybody else to be any nicer than they were to him and to me too. And my boys, I'll never forget how kind they were to him, how well they took care of him.
I told her the nursing home is out. We're going to go home. If I called them at night, they came at night. We'd ride around the yard and look at all of the flowers. And I know we couldn't have done that if we had been in a nursing home. It had to be hospital. It'd be at home, and she enjoyed that. I would recommend Grace because they help you. They tell you what's happening, and they're friendly. They just make you feel better.
We asked a doctor why he would recommend hospice to a patient and how important it is to phone hospice early.
They offer a lot of services that are not available through other means, and a lot of comfort, a lot of care, and hospice is becoming more and more a plan for those families. There's a lot to offer, and we try to plan ahead and make it as comfortable for the patient and as easy on the family as we can. I've never heard a patient say they were not happier in a home environment than a hospital environment. I think one of the mistakes we make as physicians is to not allow that patient to have enough time in hospice care.
How closely does hospice work with the family physician? And how do you talk to the family about hospice?
it comes a time where when a obviously terminal diagnosis occurs with a patient, then I begin to talk with the patient. I begin to talk with the family. And we've gone through every process that we can to see if there's any reversible issues, and we've made sure we've done everything we can to give them a chance to have reversibility of their medical problems, and it doesn't occur, and it becomes obvious. And at that point in time, families and patients need some assistance. It sets a motion in peace that allows them to come together with a group of professionals that can assist them to continue their care when they realize their limitations of the body has gone too far. And I'm just glad it's there, it's available. And for me, it's just a discussion with the family, it's a discussion with the patient. We've pretty much done everything that is possible to make this thing reversible, and it's time to not, it's time to celebrate life, celebrate peace, and set up a situation where everybody will be comfortable. We work closely with hospice, and in particular Grace Hospice. They're real attentive to not only my wishes, but obviously always the wishes of the family and the patient. It's just a continuation of my support for them, and you like this opportunity to have someone that helps you extend that support to the family. Hospice is so good about pain management. They're so good about providing a quality of life. Hospice provides a new level of care that we are underutilizing, really. This provides not only professional care from a nursing standpoint, they provide professional care from ministers that get involved with the whole family, and as that relationship builds with the nurses, with the clergy, with the caregivers, it becomes almost like a family.
Is hospice care the same as home health care? No. Hospice is designed to improve the patient's quality of life when curative treatments are no longer effective. It involves the patient's doctor and a whole team of specialized professionals: nurses, social workers, counselors, aides, clergy, therapists, and volunteers. Does the patient have to stay in hospice? If a patient's condition improves or the patient decides to return to standard medical care, he or she can leave hospice. How much does it cost? Hospice at home usually costs less than hospitals or nursing homes. In most states, Medicare, Medicaid, the Department of Veteran Affairs, private insurance plans, and managed care organizations cover care. This father and daughter described the relief they felt when Grace Hospice came to help their family.
We were quite pleased and honored that they would come out and give us their expertise that we did not know existed until they got here.
They walked in and it was just like everybody felt better. Mama felt better. Daddy felt better. And God knows all of us felt better too. I wish we really had known about them before then, because we would have been happier and she would have been more comfortable if we had had them earlier. Even after Mama passed away, they still came back and they visited with us and they let us know that they cared, and they were like family. They weren't intrusive, but it's just like they kind of wrapped you in their arms when you needed them the most. They were there, and they would come anytime. I wish we had found them so much earlier. I really do.
If you're considering hospice, don't hesitate to call Grace. We'll answer any questions you have, and we'll work with your physician to determine appropriate care. If you begin hospice and then decide that hospice care is not what you need, you have no obligation to continue. Please talk to your doctor about all available options.